Dr. Singh, what would you say to the person watching who is in a lot of pain and just says, but I've heard it's a nightmare type surgery. I'm really scared of it. Address that, because a lot of people are probably thinking that.
Right, and I like to jokingly call it the plane crash news. When the plane crashes, we all talk about it, but when the plane lands and takes off perfectly, we don't talk about it. So that one patient who's had maybe a bad outcome or a painful outcome will tell a lot more people than a patient who's doing well. But I will go ahead and tell you that the advancement and back to the arthroscopic surgery, the techniques within arthroscopic surgery, the speed of surgery, they have all actually changed lives much faster, and have actually gotten a lot more. Surgery now, if I may, is not an unpleasant experience anymore. It's not, surgery doesn't equal pain and howling and screaming anymore.
In fact, most people have less pain the day after their rotator cuff repair than they did the night before.
Well, and one of the things when you started this show was you were saying, you looking at the camera and saying, you don't have to hurt.
You don't have to hurt.
You
don't have to hurt.
need to just, I mean, because I think a lot of people in our area think this is my way of life and this is the way I'm going to have to be. And it certainly is worth it. And everything that you all have shared with me, you don't rush into surgery. Surgery is what's done if other techniques and other things don't work.
That's right. And even if you do have to go to surgery, let's talk a little bit about the anesthesia.
Absolutely.
Every single modern hospital has enrolled anesthesiologists now that have very special training, particularly for shoulder surgery and my upper extremity surgery. That means that you just pretty much need twilight sleep. You don't have to get a tube in your throat in most cases. You don't get intubated, is our word for it. And you're numbed up before the surgery and you don't know what's going on. But when you wake up, so to speak, you don't wake up in any pain whatsoever. And we overlap that with long-acting numbing medicines and then oral medication. So there's a nice transition from how we treat you immediately before the surgery, during the surgery, after the surgery, and your medications at home, and they blend perfectly.